It's that time of the year again. Annual enrollment or open enrollment. Everybody calls it a little bit something different. And I'm going to give you some tips, 5 tips, on how to make your annual enrollment a little bit better and a little bit more understandable and successful for the upcoming calendar year. A few things that you want to take into consideration, and you might want to just write these down. It's only 5 tips, but it's really important. Know your dates. Your employer is going to send you out a notification either by email or by snail mail sometimes, and they'll give you a notification, let you know what specific dates your annual enrollment period is going to start and when it's going to end. And these dates are very, very important because I would encourage you to make it a successful annual enrollment that you enroll in your benefits earlier than later. I can tell you from experience, if you have any questions or concerns, or you're trying to compare benefits or coverages that are available for you in the upcoming calendar year, and you wait to the last minute, you're probably not going to be the only one that's waiting to the last minute. And those phones, if you have to call a member services company or your HR department, or you have to call the health plan directly, those phones are going to be very busy. And people are going to be asking detailed questions, and the conversations are going to be long and deep conversations. And you may be on hold for a long time trying to get through to somebody to help you with your annual enrollment. So, very important, know the dates, be prepared for the dates, and make sure you do not wait to the end of your open enrollment period to enroll in your benefits. Now, what you can do to kind of prepare yourself a little bit in regards to the selections that you want to make is gather your explanation of benefits that you've been receiving from your health insurance plan. If you've had claims in this current calendar year, you've been sent explanation of benefits either through your insurance portal or through the mail. They'll mail the explanation of benefits out. This gives you a pretty good idea of what type of health insurance expenses you had in this current calendar year and what you may incur in the upcoming calendar year, albeit you may have different surgical procedures or there is an emergency or an urgent care visit, things of that nature. But the explanation of benefits can give you a guide on what to expect as far as what you've done in the past year or years as far as your healthcare expenses are concerned. So I would encourage you to gather the explanation of benefits, see what you've paid out of pocket currently up until this time of the year. I know it's going to be September or October that those open enrollment windows are coming up, and you're only going to have explanation of benefits for 9 or maybe 10 months out of the year. But it'll give you a pretty good insight in regards to how you've used your health insurance, whether you're a single person or a family or a couple or whatever. It gives you a basis to make a decision on what you want to compare is available for you this year compared to next year. You may have different options. You may have higher deductible plans. You may have lower deductible plans. You may have opportunities to enroll in some other things called HSAs and FSAs, and I'll talk about those in a minute. Understand what your healthcare costs are in this current year and prepare for next year and look at what you may want to select based on how you've used your insurance and how you may use your insurance in the upcoming calendar year. So first and foremost, know the dates and gather those explanation of benefits. That's tip number one. What you want to do also is you want to review your healthcare options. What type of healthcare do you want to use? Are you currently enrolled in an EPO plan or a PPO plan? Have you selected an HMO plan? And are you familiar with the differences if you decide to go from an HMO plan, which is a very specific plan where you can only use in-network providers, and there's a gatekeeper called your primary care physician, where you have to go through that primary care physician in order to get referrals to see specialists. If that's something you're comfortable with, then you're fine, and you can continue to look at a plan that's like an HMO for the upcoming calendar year. You may want to compare that to an EPO plan, which is similar to an HMO plan, but you don't have the gatekeeper. You don't have that primary care physician that's required to give you a referral to go see a specialist, orthopedist or pulmonologist or dermatologist. An EPO plan allows you just in-network benefits, but you don't have to go through the primary care physician to get that referral. So maybe you'll go from an HMO to an EPO. Or you may decide, I don't want to be restricted and I want to have the opportunity to go out of network and use out-of-network providers, and you might want to select a PPO plan where you can actually go both in and out of network albeit your out-of-network benefits are a little bit less, you're going to end up paying more out of pocket, but you do have the flexibility. If for some reason you have a primary care physician or a doctor that might not contract with plans that are available for you next year, and you want to stay with that doctor because you have a good relationship, that PPO plan may be the plan for you so that you can continue to see the doctor that you're more comfortable with seeing over the past years, and they're not in network with your current plan benefits for the upcoming calendar year, but you can use the out-of-network benefits. There's also the high deductible health plan. High deductible health plans, if you're a relatively healthy individual, you'll have in and out of network benefits. You'll have a high deductible where you're taking on more responsibility when you go to seek care, but albeit you don't have to pay premiums as high as if you had an EPO or an HMO plan, or even a PPO plan. Your premiums may be significantly lower if you're a relatively healthy individual, don't use your health care very often, and you want to look at high deductible health plans. So tip number 2, you want to review the healthcare option benefits that are available to you. Sometimes there's comparison charts that you can take advantage of. They'll be side by side on your HR benefits website or the health plan website, and you can kind of compare and go line item and look at these benefits. What's going to be my monthly premium? What's going to be my deductible? What's going to be my out-of-pocket max? In network, out of network, what do I have available to me? Tip number 3, compare the premiums and the premium options that are available to you. Once again, you're talking about different health plans. What are you going to pay every month out of your pocket, out of your check? What's it going to cost you for your health insurance? The other thing, what's it going to cost me if I have a copay or not a copay? Will I have deductibles? Do I want to pay out of pocket and have deductibles? Do I want to have higher deductibles and pay lower premiums on a monthly basis, but when I go seek care, I'll have higher deductibles, and then I'll have higher coinsurance as well. So you'll be able to compare your plans on your member services or your HR department's website or the health insurance website, however your company handles it. You can look at the premiums, you can look at what the deductibles may be, what your copayments, if you have copayments on the plan you select, would be, any coinsurance, and most importantly, what is your out-of-pocket max going to be for the upcoming calendar year? The reason you want to know these things is because, once again, if you are deciding on having maybe a child or a family, or you're going to have a surgery next year and you know something's upcoming, you can be better prepared for those types of things, understanding what your copayments, coinsurance, deductible, and out-of-pocket max may be for the upcoming calendar year. So you want to make sure that you compare premiums and understand what your out-of-pocket max is for the calendar year coming up. So that's tip number 3. Tip number 4, compare the benefits and the coverages. Understand what providers are in network with your benefits plan. Now, the last part of that's a little bit complicated because most people do not realize that it's not the insurance plans that decide if they want this doctor or that doctor or the other doctor to be in network with the benefits plan. It's up to the doctors and the hospitals and the facilities, urgent cares, laboratories, things of that nature, to decide what insurance companies they want to contract with. So you may want to check during your open enrollment period this year if your doctor is going to be in network in the following year. Beware though, those contracts can change. So even if you find out your doctor's in network in September, October, November of this calendar year, and you go seek care in January, the first thing you want to do is either call your member services company, call the health plan, or if you can go onto the health plan website yourself and check and confirm that the provider you're going to see in the upcoming calendar year still contracts with your insurance plan that you've chosen for the next calendar year. Specifically, in order to do that, you want to look up Dr. John Doe, for instance, if that's your primary care physician, and in January or February, if you're going to go see the doctor, give the doctor's office a call. Ask them specifically. Don't ask them if they take your insurance. Ask them, do you contract with my insurance plan, and may I have your NPI number? It's the provider identification number they use when they submit claims to insurance plans. So what you can do by gathering that information, first of all, you get confirmation from the person you're speaking to at the doctor's office. Yes, we contract with your insurance plan. But secondly, you're going to ask that person, for that NPI number, so you can actually go onto the benefits website and confirm for yourself that that NPI number and that doctor matches up with in-network providers for the upcoming calendar year. So it's really important to make sure that you're asking, number one, are you contracted with my insurance plan? And I'd get the person's name you're talking to and write down the date and the time you talk to that person, because if there's any confusion or any misinformation provided, you want to know who provided it. And then also take personal responsibility, ask them for the NPI number so that you can look up and confirm that that provider, that urgent care, that facility, that hospital is in network with your benefits plan as well. So really important, understand the coverage and benefits and the in-network providers. That's tip number 4. The coverage and benefits are huge. Some people may be, like I said, considering a certain surgical procedure, and they may have better coverage available to them on one plan compared to another plan if they're going to have knee replacement or a hip replacement, if they're going to increase their family and have a baby in the upcoming calendar year. You want to know what the prenatal coverage is going to be, what the delivery cost is going to be for a child. You want to understand what the doctor's visits, any kind of testing that the doctor wants to do during your pregnancy. All these things are going to be listed for you on the plan comparisons that you have during your annual or open enrollment period. So it's really important for you to do your homework. And unfortunately, it's your responsibility to do that homework. You have to understand what it is that you're getting into, what it is you're selecting, how it best fits you and your family's healthcare needs in the upcoming calendar year. These things are vitally important so that you have the correct coverage and benefits so that your family is taken care of properly. And it's the most affordable care that you can get with the benefits that are available to you. Now, sometimes what happens is companies will offer you the opportunity to pick up the phone and call their HR department and discuss what benefits are available in the upcoming calendar year. You may have a specific member services company that you do business with through your company, and you can actually reach out to that member services company as well to compare coverages and benefits and get an explanation about how is this going to be covered or how's that going to be covered. Do I have fertility benefits? If I want to have a child and I'm having difficulty having a child and conceiving, does my plan cover fertility benefits? There are certain things that certain plans may or may not cover, and if you don't ask the question, you're not going to have the information that you need to make the best decision for you and your family in the upcoming calendar year. So compare the benefits, compare the coverage, and understand what type of providers are in network with the plan you are going to decide to select. Now, the 5th and final tip I'd like to encourage you to consider is if you are going to go with what's called a high deductible health plan, you have the opportunity to enroll in what's called a health savings account. A health savings account is where you can actually put money aside out of your paycheck before taxes into an account that belongs to you and your family should you leave your current position or your current job. That goes with you. A health savings account is your money, pre-tax money, that you can use for qualified health insurance expenses. There's a great deal of information on the IRS website. Okay, I don't know the exact publication number. I don't want to misquote a number to you, but you can actually look at what healthcare benefits are available for you with your HSA. You can put money aside in that HSA. Some companies may even contribute and or match HSA contributions. So it's extra money that your employer may be giving to you that you could take advantage of. And again, if you're a relatively healthy individual and you're considering maybe not using your health care too much, a high deductible health plan partnered with an HSA may be a great benefit for you. So something to consider. Look it over, talk it over, do some research on these. There's other videos that I'm making in regards to HSAs and high deductible health plans as well. You can take a look at those. If you have questions, put some questions in the comments below. I'll be more than happy to get back to you either on the comments section, or I'll create another video to answer your questions specifically about that. And hit the notification button so that you know that when the video is posted on YouTube, and that way you'll have some answers to your questions. The other thing you want to consider is a flexible spending account. Now, flexible spending account's a little bit different. That money, it's a use it or lose it situation in the calendar year that you're going to be putting money aside for your healthcare expenses. So it's a little bit different than an HSA, okay? So what you want to do, kind of going back to the first tip, look at the explanation of benefits and what your healthcare costs were in this current calendar year and decide if you want to put money away or need to put money away in a flexible spending account to help you cover those healthcare expenses in the upcoming calendar year. Now, you may or may not have any expenses to worry about, but you can actually consider what options are available to you, what type of surgeries or what type of things you may be considering having in the upcoming calendar year, and contribute to a flexible spending account that way as well. And you can contribute to a flexible spending account, you know, with an EPO or PPO plan. The high deductible health plan is usually with the HSA, so that stands by itself. But a flexible spending account's another way to help you pay for your insurance costs in the upcoming calendar year. But really remember this, it's a use it or lose it situation. So if you put $2,000 or $1,500 in that FSA and you only use $1,000, that $500 is gone. Okay, so do your research, do your due diligence, talk to your member services, talk to your HR department, make sure you get answers to the questions that you have with those folks. Now, as far as the last option that's available to you, there's something that's called a health reimbursement account. And sometimes what happens is it's an account that your employer owns, okay? You can't take it with you when you leave, unlike a HSA, which is your money. But the health reimbursement account, you contribute money and you can use it a little bit like a health savings account, but your employer also puts money into this HRA account too. So check that out. See if your employer is offering an HRA, an HSA, or FSA, and that will help you with your healthcare costs in the upcoming calendar year as well. So 5 tips. Remember, you want to know your dates. Really important, know your dates. Be prepared for those dates. Gather the information that you need so that you're prepared to make the educated decision you need to make, because what you're going to do is you're going to be prepared. You're going to review what your health plan options are, what the coverages and benefits are, if the providers that you see are in network with the benefits plan, and double check in the upcoming calendar year that those folks are still in network and contracted with your insurance when the calendar changes to the new year. Understand what your other options are: flexible spending account, health savings account, health reimbursement account. Be prepared. It's a very important time. Sometimes folks don't pay much attention, and if their employer says it's a passive enrollment where you don't have to do anything, your benefits are going to roll over the same way, you might be in a situation where the doctors that you use or want to continue to use no longer contract with that plan, even though it's the same plan in the new calendar year. So we need to take personal responsibility for our choices, our health care. We need to be prepared. So gather information, know your dates, don't wait to the last minute. Talk to your HR department or your member services about what your healthcare needs are going to be or anticipated needs in the upcoming year, and understand your coverage and benefit options available to you, whether it's an HSA, FSA, or HRA for your money contributions where you can pay for your healthcare expenses, or is it a health plan? Is it an HMO plan? Is it an EPO plan? Is it a PPO plan? Is it a high deductible health plan? Understand what these are. I have other videos available to you as well. Should you have any other questions or concerns, please, in the comments, feel free to drop some comments down there. I will do my best to get new content out with those. Otherwise, I will answer those questions right down below. Hit the notification button, subscribe to the channel, share this with your friends, family, and maybe even your coworkers if they need a little bit more help with understanding annual enrollment and how to become prepared for your annual enrollment period in the upcoming calendar year. Until next time, thank you very much for watching. I hope this is helpful. If you find this content useful, once again, give me a thumbs up, hit the notification button, like the video so YouTube knows that this will go out to other folks that have questions about their home insurance, auto insurance, health insurance, and life insurance. Have a great day and have a wonderful open enrollment or annual enrollment. And I wish you good luck. Drop some questions if you have them. Thanks again. Take care. Bye now.